Hello, everybody. Can you hear me okay? Awesome. Well, we'll go ahead and get started. Thank you for joining us this afternoon for an information session on the PPO 123 plan that we offer here at Hospice of the Piedmont. Our goal with these information sessions is to provide you plenty of information to know how the plan works so that you can select the plan that works best for you and your family. So we'll go ahead and get started. So real basic here, what is a PPO plan? A PPO is a preferred provider organization. So it offers a network of providers who have agreed to provide care at a certain rate. That's the contracted rate with Blue Cross Blue Shield. And you, as a plan participant in a PPO, have the freedom to see any doctor or specialist in or out of network, and you can do so without a referral. Your greatest cost savings, of course, and your greatest coverage is realized when you see an in-network provider. PPO plans do typically have higher premiums on a biweekly basis, and that is true here at Hospice of the Piedmont. So I want to make sure that we understand some basic terminology as we get started so that we're all on the same page. A deductible is the set dollar amount that you pay towards covered medical services each benefit period before Blue Cross Blue Shield starts paying towards those services. So your co-pays for visits and your prescriptions do not count towards your deductible in a PPO plan. Co-insurance is your share of the cost of a covered medical service. This comes under tier 2 and 3 in the PPO 123 plan, and I'll explain that a little bit more in just a few minutes. And then lastly, out-of-pocket max. This is the maximum amount that you pay for healthcare in a year before your insurance starts paying 100% for all covered services. And so the out-of-pocket max does include your deductible, co-insurance, and co-pays. So what is a PPO 123 plan? This is a multi-tiered plan that divides coverage into 3 benefit levels. So the plan combines both co-pays for some services and then payments towards the deductible for other services. And it does depend on the type of care that you're receiving. So level 1 is primary care and preventive care. Level 2 is inpatient care. And level 3 is outpatient care and professional specialist care. So we're going to look at these tiers a little bit more in depth. First, level 1. This is your preventive care, and it's covered at 100%. And that includes things like annual exams, well child, well baby, well woman, and different types of screenings. It would include colonoscopies if there are no issues found during the colonoscopy, cervical or ovarian cancer screenings, and mammograms. And then you have your primary care visits that are a $35 copay. That's if you go to the doctor for a sickness or anything like that, and it is your primary care provider. You also do have a telehealth benefit with the PPO 123 plan under level 1 that provides a $35 copay. And then also mental health and substance abuse services in office are covered at a $35 copay. So let's look at level 2. Level 2 is your inpatient services. Here you're going to pay towards your deductible, and then you pay 30% of the contracted rate. That means that the insurance is going to be paying 70% for you. So inpatient hospital services do require that you pay a $250 copay, and then you pay towards your deductible. Included in this level are things like skilled nursing facilities, home health and hospice, inpatient ambulance services, inpatient fertility, inpatient mental health facility and professional services, and inpatient substance abuse facility and professional services. So any admission here, you do have to pay a $250 copay, plus you pay towards your deductible. Once you meet your deductible, then you pay the 30% of the remaining contracted rate. So in any of these cases, once you meet the deductible, the insurance is going to pay 70% of the cost. You pay 30% of the cost until you meet your out-of-pocket maximum. Then we have level 3. Level 3 is outpatient services, and you are paying towards your deductible here. And then you pay 50% of co-insurance towards your out-of-pocket maximum. So this includes specialist office-based visits, outpatient services, urgent care, emergency room visits that are not paired with an admission, outpatient hospital services, therapies like PT, OT, chiropractic, or speech, CT scans, all of your diagnostic scans like MRIs, MRAs, and PET scans, infertility services that are outpatient mental health facilities and professional services, and outpatient substance abuse services. You do have prescription drug coverage under the PPO 123 plan that provides for copays. Again, copays do not count towards your deductible. And there are certain preventive over-the-counter medications that are covered at 100%, and then contraception is also covered at 100%. So your tiers are 10, 25, 40, and 80, with tier 5 drugs being 75% that you pay, 75% of the contracted rate. You do have limbs and frame coverage on this plan, reimbursement up to $130, and then insurance will cover 10% of additional cost. And this is in addition to the emeritus vision benefit if you have that vision insurance with Hospice of the Piedmont. All right, so let's look a little bit at our current plan here at Hospice of the Piedmont. We have a PPO 123 2500, and that means that the deductible for individuals is $2,500. The deductible for families is $5,000. So how exactly does a deductible work for each tier of coverage? Under employee only, you as the employee pay $2,500 and then you move over to co-insurance. But how does it work if you insure more than just yourself? If you insure employee spouse or employee child, each of you will pay a $2,500 deductible and individually move to co-insurance when the deductible is met. So that means if I, as the employee, pay $2,500 towards covered services, I would move and start paying the co-insurance of 50% or 30% that the insurance isn't currently covering. And then my spouse or my child would also meet a $2,500 deductible before they moved over to co-insurance. Once we've met the full $5,000, we would both be covered under co-insurance and would pay up until we met our out-of-pocket maximum of $8,150. So similarly true for employee plus children or employee family. Any individual that meets $2,500 would move over to co-insurance. If a second person meets $2,500, then everyone that's covered, everybody in the family or all of the children, would move to co-insurance. Or a combination of individuals that meet the total of $5,000, and then everybody moves to co-insurance. So I know that can be a little bit confusing. If you have any questions at all about how deductibles work for the PPO 123 plan, please don't hesitate to talk to somebody in HR. So the next step of our PPO 123 plan is the co-insurance. Insurance does pay 70% of tier 2 and 50% of tier 3, with our out-of-pocket maximums for employee only being $8,150, and then for employee plus coverage, that's employee spouse, child, children, or family, being $16,300. So let's look at as an example of how the copays, deductible, and co-insurance works towards meeting your out-of-pocket maximum. So let's say to date in your plan, you have had prescription cost of $150. That doesn't apply to your deductible. You've had copays to date of $250, again, not applying to your deductible. And then you have an emergency room visit. You're not admitted, so this is outpatient care, which falls under Tier 3 coverage. Your total hospital bill is $30,000, but Blue Cross Blue Shield's contracted allowable amount that you are billed is $13,000. So you're going to pay your deductible of $2,500, and then you're going to begin to pay co-insurance. So your co-insurance is 50% of the allowable amount. So you've already paid $2,500. That reduces the allowable amount to $10,500, and you pay half of that. So that's $5,250. Now, because you're paying towards your out-of-pocket max and you're in the co-insurance era, you also have the benefit of your prescription drugs and your copays that you've paid previously now applying to your out-of-pocket max. So that adds another $400. So at this point, you've paid $2,500 in deductible, $5,250 in coinsurance, and $400 for prescriptions and copays. That totals $8,150, which is your out-of-pocket max, and all future costs within the plan year are paid by insurance. One more example for employee plus coverage. This would be for employee child, employee spouse, children, or family. So if you have prescription costs to date of $500, annual copays to date of $1,000, and then you have a scheduled inpatient surgery. Because this is inpatient, it is Tier 2 coverage. And your total hospital bill is $50,000. The allowable amount under Blue Cross Blue Shield's contract is $25,000. That's what you're being billed. Because this is an admission to the hospital, you do have a $250 copay. You're going to pay $5,000 to meet the deductible. The remainder goes towards your out-of-pocket max, and your part of the coinsurance is 30% of the allowable amount, $6,000. So now that you're in coinsurance, paying towards your out-of-pocket max, your copays and your prescription drugs apply, adding $1,750. So your total paid is $12,750. And because you've met the deductible, all family members are now covered towards your out-of-pocket maximum. You are going to continue to pay coinsurance, copays, and prescription costs until you and all family members combined meet the $16,300. So our out-of-pocket maximums being $8,150 and $16,300 are pretty costly. This isn't a plan that is most advantageous if you are planning for a big event like surgery or pregnancy. Our high deductible out-of-pocket costs are much lower, but there are ways to offset costs with the flexible spending account. Flexible spending accounts are a payroll deduction that is taken pre-tax. Flexible spending accounts are IRS regulated and are use it or lose it, which means that it will not roll over into the following plan year beyond the allowable period. Contribution limits for the 2022 calendar year have not been set yet, but the current limit is $2,750. So we will probably see it stay about that amount or maybe go up $50, but that's yet to be seen for 2022. This money is available to you at the beginning of the plan year to use towards qualified medical, dental, and vision costs. So if you decide that you are going to contribute $2,750, it's available to you immediately, and then you repay through payroll deduction. So it's really smart to plan for known procedures, copays, prescription costs, to plan out how much you believe that you'll use in a plan year, and only set aside that amount because it is use it or lose it. We don't want you to lose any funds that you pay in. So if you're in a PPO 123 plan and you're new to that plan at open enrollment, you can start with a flexible spending account. If you're coming from the high deductible plan, you cannot contribute to an HSA while you're on the PPO 123 plan, but you can continue to use any HSA dollars that you've previously contributed. If you're currently on the PPO 123 plan, you will be able to enroll in the FSA for a January 1, 2022 start date. So there are a little bit of, there are some ins and outs and a few complications when you move between PPO 123 and high deductible plans in either direction. But we have all of that information for you and can fully support you as you make that decision. More than happy to do that. So please seek out somebody in HR if you have a complicated situation and want to learn a little more.